Welcome to my office. Today I'd like to talk to you a little bit about protection for your skin and how you can maintain your skin looking younger longer. I'm sure you've heard, excessive sun exposure can be dangerous to your skin, not only because it causes skin cancers, but also because it causes premature aging. You see this with premature wrinkling, sunspots, and a leathery feeling to your skin. There are some medical conditions, such as lupus, that can be worsened by the sun. There are also some medications which will make your skin more sensitive, such as antibiotics, which we use frequently in the office to treat acne, retinoids, diuretics, and antidepressive medications. When you use a sunblock, you should apply it every day, not only occasionally. The sunblock should be a total sunblock that covers both UVA and UVB light. The active ingredients. Make sure that you have one that has either titanium or zinc oxide, parsol or avobenzone. It is important that you like how the sunblock feels so that you'll use it every day. In other words, if your skin is very oily, you will like gels or alcohol-based sunblocks. If your skin is very dry, you will like creamy sunblocks. Let me show you how to use the sunblocks. This is one of the sunblocks that we have in the office. You should apply a small amount in your hand and smell it to make sure that you like how it smells and how it feels, so that you will use this on a regular basis, not only occasionally. On a regular basis, you should apply antioxidants because they help to revert the damage that the sun has produced throughout your lifetime. Antioxidants such as this one contain iron and ascorbic acid. You can apply it on a daily basis. You just use a small drop under your sunblock, and at night you can apply it together with the glycolic or retin-A that you may be using.
I have these short eyelashes. They're thin and they're short. Isn't there anything I can do to lengthen them?
Actually, there is a new product. It's called Latisse, and it was developed by Allergan. And as you know, Allergan has been in the ophthalmologic market for a long time. The decrease in the eyelashes is called hypotrichosis. So Latisse is used to correct the hypotrichosis. It does this probably by increasing the anagen phase, which is the growing phase of the eyelashes, and also by increasing the number of eyelashes that are in that phase. They're not sure if that's how it works, but this is how they think it works. Let me show you the product. Actually, I have it right here. Allergan is really the only company that has this approved. It's FDA approved now, and they supply it to the patients with 2 brushes, and you apply a small drop into one of the brushes and you put it on the upper eyelid only at night.
Would I be a good candidate for this?
As long as you don't have a history of glaucoma. Do you have a history of glaucoma or any eye problems? If you use contact lenses, you need to remove them before you put the medication on at night. So you put this is applied, it's enough for 1 month. You apply 1 drop, and with 1 drop, you put it in one of the pencils, and then with the other drop and the other pencil, so they don't want you to cross-contaminate the liquid.
That seems simple.
Yes, the results are very good. It takes about 2 months to see them.
How long does it last?
Okay, as long as you use the product, you will continue to have the eyelashes thicken. When you stop using the product, the eyelashes, like your hair, they have like a 3 to 6 month cycle. Okay. So if you stop using the product, then the eyelash thickness and increase of them will decrease to your normal level. So the Botox and the Restylane is starting to go away. It's been, what, about a year for the Restylane?
Yeah,
and
I think I need more.
It's been about, what, 3 months? 3 or 6 months for your Botox?
Exactly, yeah. I can tell it's not there anymore.
So let's see how you're doing, Dawn. Raise your eyebrows up. So you need it there. And frown. You need it there. And smile for me really hard.
Does it look like I need some?
You're getting there, yes.
Yeah. Okay, yeah. So let's do everything today.
Okay, and let's see here on the lips. I can get normal. Do normal. And take a look in the mirror. So if you wanted to, because your upper lip is a good size and the nasal lip, but what I see, it's here, the marionette lines here, and here.
Oh, yeah.
So what we need to do is a little support. You're smiling, you're not sad, just there. With 1 cc of Restylane, I can bring this up for you. So which of the two sides do you think is worse, this one or this one?
I think the right one.
Yeah, I agree with you. Over here, it's a little bit more marked. Okay, so we can do it with the numbing cream as we've done in the past, but if you want a nerve block, I can still do the nerve block. You remember the nerve block is like at the dentist and then you swell up for a few hours.
Oh.
But you usually tolerate it well with the cream.
Yeah.
Okay, so let's apply the cream. We apply a very tiny amount right under the skin, and in this area it's very superficial. And it's usually about 15 units in each side. So this syringe has a 30 units. So it's about half the syringe goes here, and the other half goes on the other side. That little bleb that forms, it's so that it stays very superficial. In about half an hour, it'll go away. And so here, depending on how the patient has the lines, and some patients like to raise their eyebrows up, so we inject it a little different. Dawn told me that she didn't want her eyebrows up, so we basically inject the Botox throughout the whole area on the forehead. Otherwise, we sometimes skip that middle part. Inject Restylane in order to correct the depression that she has in the corner of the lip that makes her look sad. And afterwards, we're probably going to put a little bit of Perlene, which is a little bit thicker type of Restylane on this area to help maintain a little bit of support. Here we go. Dawn, take a nice deep breath. This does hurt a little bit. Take a deep breath and breathe, and breathe. That's it. Perfect. This is the worst part. The good thing about the product is that it lasts a year, so you don't have to do this every week. And also that you see the results right away. Okay, and breathe. Okay, so they're all ready. Stay off for a sec. You really may not even need the Perlene. So a lot of times we see how it works. Let's see, relax a little bit. So after the Botox, what you need to do is you need to move the muscles so that the medication goes to the location. In other words, I need you to smile, raise your eyebrows up, and frown. About 1 or 2 minutes every 2 or 3 hours during the next 2 to 3 hours. Don't rub the area. Don't start rubbing it because then you'll move it.
Oh, okay.
And you can exercise, but I don't want you doing like yoga where you have to put your head below your knees. You can do weights, you can do a little bit of legs, but don't start doing the yoga type of exercises.
Okay.
And as far as for the Restylane, you did great. You have no bruising. That looks very good. And
It
just
feels great.
good. And that will last you a year. The Botox, we're going to see the results next week.
Okay.
If you need any type of touch-up, then you just come in and I'll do it as part of this treatment. So you may have gotten the dark spots from pregnancy, but maybe also from the sun exposure. The other reason why we sometimes see it, like if you've had an acne spot that explodes or you pick at, you can stay with what we call post-inflammatory hyperpigmentation, which is just darkening of the skin. But 95% of the time, I can clear this for you. But it's not only with one product. You need several products. And it's important that you use them the way I tell you because I make some of them and they're very strong. So what I usually do is have you, and I have it all written down in the front before you leave, they're going to give you a card. And the secretary is going to go over with you how to use it. But basically what you need to do is you need to wash your skin, and we usually recommend the glycolic acids because they'll take off all the oil so the medicines come in easier. Then you put the fading lotion. Now the fading lotion, but you have to use a small amount, otherwise you will get irritated. Basically what you need to do is you need to apply, let the liquid go into the sponge and apply a small amount, like that much for your whole face. Mainly at the beginning, make sure it's wet and then just apply one dot, okay? And then with your fingers, go like that, okay? Okay, you do that in the morning and at night. And then you put on the fading cream. The fading cream, again, this is the one I make, and this one is really, really strong. So if you take the fading cream and you put a lot of it, you're gonna come back red and inflamed. Let me just show you about the exact amount you want. You see like that much? Mm-hmm. That's all you want. In other words, you take your finger and what you can grab in one finger, that's what you put on your whole face. After 2 or 3 weeks of doing this, then you can put a little more, but mainly at the beginning so that you don't get an irritation. So after you put the fading cream, then you put the sunblock. And as we spoke about in the past, you need a sunblock that you like. I like a lot this one, the Kubrins sunblock, just because it's easy to put on, it's not creamy, and then after I finish putting it on, I put it on my hand so I don't get the brown spots on the hand. So that's the advantage of this type of sunblock. At night, you do exactly the same thing, but instead of using the sunblock, you use an exfoliator, which could be a glycolic or it could be retin-A. Okay, do you have any questions?
I noticed this has some color into it.
The company has made 3 basic types of skin colors,
So
and I have a tester outside, so you can
Great.
test it for you.
Okay, that would be wonderful. Thank you.
You're welcome. It's been a week, the Botox and the Restylane. Let's see how it looks.
You'll be very surprised.
Let's see, can you raise your eyebrows up? And can you frown? A little movement so it looks natural, good. And let me see, can you smile? Beautiful.
All of it's gone.
Okay.
I have no lines on my forehead, and my eyes have no lines.
Okay. Did the husband notice?
Right away.
Okay, good.
Right away.
And how about here? We did a little Restylane here.
It was very droopy before, and now it comes up.
You're happy with that? That's enough?
Very
It looks
much.
very natural.
It looks great.
Good.
I'm so happy. It took at least 5 years off my face.
Beautiful, good. For your convenience, we have 3 medical offices. They are located in Key Biscayne, Coral Gables, and in Tavernier, the Florida Keys. All of the offices are connected through electronic medical records. The systems are integrated, so all of your histories, treatments will be kept in the same files and available to any of us to see. I hope that you found this information useful, and we're looking forward to seeing you shortly.